So hi guys, you are welcome to Dssg Nation. So if this is your first time watching a video from Dssg Nation, do make sure you subscribe and hit the bell button so we can notify you whenever we create a video. So today we are going to be talking about myocardial infarction. So pick your paper and your pen and let's get started. Hi guys. Yeah, welcome back. So I said we are going to be talking about myocardial infarction. So myocardial infarction. Now, the word myo means muscle, and the word cardial, it means the heart, and the word infarction means death. So, if you say myocardial infarction, it means the death of the muscle layer of the heart. So that is the meaning of myocardial infarction. The death to the what? To the muscle layer of the heart. Now, what are the causes of this disease condition? Causes. So, the causes is just like that of the angina pectoris. So you can have the thromboembolism. So you can also have fat embolism. So after that, you can also have arteriosclerosis, So you can also have atherosclerosis as well. Atherosclerosis. So and so on and so forth. So those are the what? Those are the causes of myocardial infarction. So what happens in myocardial infarction? We said it deals with what? The death of the muscle layers of the heart. So let's quickly come in the diagram of our heart as usual. So here's the diagram of our heart. So now, the muscle layer of the heart. We know that the function of the heart itself is to do what? Is to pump blood to all the body parts. The function of the heart is to pump blood to all the body parts. Now, if it's taking blood to all the body parts without giving it back to itself, it means it's going to die. Because I used to say blood is the food for all organs. Now, there are some kind of arteries that brings blood back to the heart as well, so as to feed the heart. And the name of those arteries are called the coronary artery. So, the coronary arteries, they are those ones that bring oxygenated blood back to what? Back to the heart. Now, in myocardial infarction, this coronary artery is occluded either partially or totally. If it is occluded either partially or totally, there is going to be starvation of this cell. So the cells are going to become ischemic. So they are going to become cyanotic. So the lack of blood supply to the muscle tissue will make them ischemic and they are going to die. And that is what's happening in myocardial infarction. So let's go next to the pathophysiology. Yeah, welcome back. So I said we are going to be talking about the pathophysiology. Pathophysiology. Now, while talking about pathophysiology, we have to pick a cause, and then you are going to tell us how it's run its course. So, we said if this is the coronary artery now, the coronary artery. So we listed a lot of causes like embolism, thromboembolism, fat embolism, hyperlipidemia, arteriosclerosis, and the likes. So let's just pick, let's say thromboembolism for example now. Now, if there is a damage to this coronary artery, just at this point, the platelets within the blood are going to come. So the platelets are what we call the thrombus. Because platelet is from the word platelets are also called the thrombocytes. So the word thrombus is from the accumulation of these platelets within the coronary artery or any kind of vessel. So that's why we call them thrombus. So this formation of thrombus now is going to reduce the amount of oxygen passing through this place to supply the muscle layer of the heart. So the thrombus is going to reduce the amount of oxygen supplied to the heart. So now, from this is just thrombus now. So it can lead to embolism if the pressure of blood coming like this, it can break it. It can break it like this, and then this remaining thrombus, it can further occlude. It can further block the coronary artery, and this is going to lead to thromboembolism. And when that occurs, there will be reduced blood supply, reduced oxygen supply to the myocardium, to the muscle layer of the heart. And when that occurs, the muscle layer are going to become ischemic. They are going to become ischemic and injured. So, and that will take us to the zone of myocardial infarction, the zone of infarction, so the zone of death. And that is where we are going to next. So, stay tuned. So now, let's talk about the zone of infarction. Zones of infarction. Now, let's say we have the heart here as usual. So, we have our valves here, the septum, valves, the septum. Now, let's say this muscle layer now is divided into three, just for descriptive purpose. 1, 2. Now, this is the first layer, the second, and the third. A, B, and C. They are all muscle layers. Now, we have the coronary artery here supplying it. Coronary artery. Now, the coronary artery has been occluded, either partially or totally. So let's choose partially now. So we have to supply oxygen. So let's say the amount of oxygen, let's say 100% oxygen is delivered to the myocardium at this rate. So now, this first layer is going to receive like 80%. So the second layer is going to receive like the remaining 20%. And this C will not receive anything. Now, because the muscle cells here are not receiving anything, they are going to die. So they are called the zone of necrosis. The zone of necrosis. And that is the first zone. The second one here is the B, receiving 20%. So they are not going to be dead actually, but they are deprived of oxygen too. So they are going to be injured and inflamed. So they are called the zone of injury. The zone of injury. So cells at that region are inflamed. The cells at that region are injured and inflamed. Now, this zone of necrosis, they are irreversible. Once they are dead, they cannot come back to life. But for the zone of injury, they are only inflamed due to the deprivation of oxygen. So they can still be reversible. So with adequate supply, they can still be reversible. Let's say this thrombus is broken down by thrombolytics. So thrombolytics is a kind of drug that works against thrombus. So they are going to come back to life. So they are reversible. So the first one here is called the zone of ischemia. The zone of ischemia. Ischemia. So this zone, they are only deprived of oxygen. They are deprived of adequate oxygen supply, of adequate oxygen, and they are reversible as well. They are reversible. So they are also reversible. So these are the three zones of infarction. So the first one is the zone of necrosis. So the zone of necrosis, they are irreversible, and the cells that are there are dead. So, and that is due to the prolonged starvation or deprivation of oxygen. So for the second layer, the zone of injury. The zone of injury, they are the one that covers the zone of necrosis, and they are inflamed, so they are injured and they are reversible. And for the first zone, they are the zone of ischemia, and that is due to lack of oxygen, and they are also reversible. And they are the ones surrounding the what? They are the ones surrounding the zone of injury, and that is that on the zones of infarction. So let's talk about the types of myocardial infarction. So now, talking of the types of myocardial infarction, we have majorly two types. So the first one is called the subendocardial, and the second one is called the transmural. Now, what is transmural and what is subendocardial? So here is our heart as usual. Now, this is just what we need. I'll just stop right there. So here are the muscle layers now. The muscle layer. So the muscle cells. Now, I'm dividing this just into two. You notice it very well. Now, in subendocardia, just the innermost muscle layer are the one affected. In subendocardia, the innermost layer of these muscle cells is affected. But for transmural, all the layers are affected. So in short, subendocardial myocardial infarction is that kind of infarction where just the innermost muscle layer are affected. But for transmural myocardial infarction is that infarction where all the muscle layers of the heart are infarcted. And that is just about the two types of myocardial infarction. Now, so what are the signs and symptoms of myocardial infarction? Example, one of the signs and symptoms is the chest pain. And tracing our pathophysiology, we realize that there is going to be a chest pain. Why? Because deprivation of oxygen is going to lead to the production of lactic acid, and that's going to result in the pain. And then the chest pain can also cause difficulty in breathing, which is what? Dyspnea. Difficulty in breathing, that is dyspnea. So after then, the pain can be referred. This pain can be referred to like the jaw, the neck, the back, the shoulder, the epigastric region, the epigastric region of the abdominal part, abdominal wall. So there can be nausea, there can be vomiting due to the irritation of the CNS, and those are the signs and symptoms of myocardial infarction. So the pain can also be radiated to the arm. So the pain can be radiated to the arm as well. So the left arm to be precise. So that means we've come to the end of this video. So if you have a question, you can just drop it in the comment section on the group. And if this is your first time watching a video from Dssg Nation, do make sure to subscribe and hit the bell button so we can notify you whenever we create a video. Hi guys.